If you are experiencing a vaginal yeast infection, Ibrexafungerp 150 mg tablet can help to treat it. This medication is also used to prevent future yeast infections. Yeast can sometimes multiply and cause an infection, especially if you are pregnant, have diabetes, or are taking antibiotics or hormonal birth control. Ibrexafungerp 150 mg tablet is an antifungal drug that works by stopping the growth of fungi, such as yeast. By taking this medication, you may experience a decrease in symptoms such as abnormal vaginal discharge, itching/soreness, pain during sexual intercourse, or pain when urinating. It is important to take the prescribed dosage at the optimal time for the best results. Before you start taking Ibrexafungerp 150 mg tablet, make sure to read the medication guide provided by your pharmacist. If you have any questions, don't hesitate to ask your doctor or pharmacist for clarification. You can take this medication by mouth with or without food as directed by your doctor, usually for 2 doses about 12 hours apart. If you are using it to prevent vaginal yeast infections, you will usually take this medication every month for 6 months. The dosage will depend on other medications you may be taking, so make sure to inform your doctor and pharmacist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If your condition persists or worsens, make sure to inform your doctor about it. If you experience nausea, stomach or abdominal pain, vomiting, dizziness, headache, or diarrhea, it's important to let your doctor or pharmacist know. However, many people using this medication do not have serious side effects. While a serious allergic reaction to this drug is rare, it's important to seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching or swelling, severe dizziness, or trouble breathing. It's essential to remember that the benefits of this medication outweigh the risk of side effects, as prescribed by your doctor. If you notice any other effects not listed here, it's best to contact your doctor or pharmacist for further guidance. This medication should not be used during pregnancy as it may harm an unborn baby. Make sure to consult with your doctor and have a pregnancy test before starting this medication. It is important to ask about reliable forms of birth control while using this medication and for 4 days after the last dose. If you are taking this medication monthly, a pregnancy test should also be ordered before taking your monthly dose, and birth control should be used during the 6-month treatment period and for 4 days after the last dose. If you suspect that you may be pregnant, it is crucial to inform your doctor immediately. Before taking Ibrexafungerp 150 mg tablet, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions or other issues. Be sure to discuss your medical history with your doctor or pharmacist before using this medication. Ibrexafungerp may cause dizziness, and the use of alcohol or marijuana can intensify this effect. It is important to avoid driving, operating machinery, or engaging in activities that require alertness until you are sure you can do so safely. It is also advisable to limit your alcohol intake and discuss your marijuana use with your doctor. If you are planning to have surgery, it's important to inform your doctor and dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. It is crucial to avoid using this medication during pregnancy, as it may harm an unborn baby. If you become pregnant or suspect that you are pregnant, notify your doctor immediately. Additionally, it is unknown whether this drug passes into breast milk, so consult your doctor before breastfeeding while using this medication. It's important to be aware that Ibrexafungerp can interact with other medications, potentially changing how it works and increasing the risk of serious side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products, and share this with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some medications can affect the removal of Ibrexafungerp from your body, which may impact its effectiveness. These include azole antifungals, such as itraconazole, ketoconazole, macrolide antibiotics, such as clarithromycin, rifamycins, such as rifabutin, rifampin, St. John's wort, and drugs used to treat seizures, such as carbamazepine, phenobarbital, phenytoin, among others. Always consult your doctor or pharmacist before taking Ibrexafungerp alongside any other medication. If you or someone else has taken too much Ibrexafungerp 150 mg tablet and is experiencing severe symptoms like fainting or difficulty breathing, it's crucial to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, you can reach out to a provincial poison control center. It's important to act quickly in these situations to ensure the best possible outcome. This medication should not be shared with others. Narration: remember to take Ibrexafungerp 150 mg tablet exactly as prescribed by your doctor. If you happen to miss a second dose, take it as soon as you remember. However, if you miss your monthly dose, make sure to consult with your doctor or pharmacist immediately to establish a new dosing schedule. It's important to store Ibrexafungerp 150 mg tablet at room temperature, away from light and moisture. Avoid storing it in the bathroom and always keep it out of reach of children and pets. When no longer needed or expired, make sure to properly discard the product. It's best to consult your pharmacist or local waste disposal company for the correct way to do so. Remember not to flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.